PTSD stands for post-traumatic stress disorder. It's a mental health condition that can happen after experiencing or witnessing a terrifying event. These events are called traumas. This could be anything from a car accident, physical assault, natural disaster, or wartime combat. PTSD is more common than you might think. It affects millions of people from all walks of life. PTSD can affect anyone regardless of age, gender, or background. It's not a sign of weakness. It's a normal reaction to an abnormal event. The good news is that with the right support and treatment, people can and do recover from PTSD. PTSD shows up differently in everyone. There are 4 main types of symptoms: re-experiencing, avoidance, changes in thinking and mood, and arousal symptoms. Re-experiencing symptoms involve reliving the trauma through nightmares, flashbacks, or intrusive thoughts. Imagine feeling like you're right back in that scary situation, even when you're safe. That's what a flashback can feel like. Avoidance symptoms are about trying to avoid anything that reminds you of the trauma. This might mean avoiding certain people, places, or activities. Changes in thinking and mood can include negative thoughts, feelings of guilt or shame, difficulty experiencing positive emotions, or feeling detached from others. It's like a dark cloud is hanging over your head, making it hard to enjoy life. Arousal symptoms are about feeling on edge all the time. This might look like being easily startled, having trouble sleeping, or being irritable and angry. These symptoms can make it hard to concentrate or go about your day-to-day life. PTSD is caused by experiencing or witnessing a traumatic event. However, not everyone who goes through a trauma develops PTSD. Several risk factors can make someone more susceptible to developing this condition. These risk factors can include the severity of the trauma, lack of social support, pre-existing mental health conditions, or a family history of PTSD. It's important to remember that PTSD is a real medical condition, not a character flaw. It's not something people can just snap out of. If you or someone you know is struggling with PTSD, it's crucial to seek professional help. Getting a diagnosis is the first step toward recovery. A mental health professional can help determine if you have PTSD and recommend the best course of treatment. Treatment for PTSD often involves therapy, medication, or a combination of both. Therapy can provide you with coping mechanisms and help you process the trauma. Medications can help manage symptoms like anxiety and depression. There are also things you can do to support someone with PTSD. Listen without judgment, be patient, and encourage them to seek professional help. Remember, recovery is possible, and with the right support, people with PTSD can live full and meaningful lives.